Everyone makes mistakes with their kids. It's natural. We mistake a sore throat for an incomplete homework assignment and then find ourselves answering a call from the school nurse a few hours later. Or we run our babies to the doctor certain they have measles, only to discover a heat rash that disappears on the ride there. We do the best we can with what we have. We check in with our instincts and adjust when we need to. When we're unsure of what to do next, sometimes we call in an expert, a teacher, a therapist, a friend, a doctor. With my younger daughter, Sammy, I did a lot of that. She had needs that were very far outside my expertise, and I stumbled pretty regularly to get them met. I made a lot of mistakes with Sammy, but the biggest mistake made about Sammy was mostly not mine. The biggest mistake anyone made with Sammy was made by a doctor. When Sammy was 4 years old, after years of reflux that you normally only see in babies, a gastroenterologist diagnosed her with a relatively rare disease called eosinophilic esophagitis. After years of treatment that included a dozen surgical procedures, documented here, we learned that the diagnosis was wrong. We also learned that some pediatric doctors, unlike us, do not call in the experts. Some doctors work in tall silos, practicing only their specialty, and despite nagging doubts, they don't ask anyone else for help. Not other pediatric doctors, not their patients' parents, not the other medical professionals around them. My daughter went through a lot of medical trauma before we found the real diagnosis. It should not have been like that, and it doesn't have to be like that. I'd like to talk to the world of families in the middle of medical mystery, both to share our story and to examine, after the fact, what we could have done differently, me and the doctors caring for my daughter.